Hi friends, I am Dr. Tarun Satija. I am a consultant physician based in Ludhiana and I'm here to present the next episode of COVID-19 myths and queries. Well, in the last episode, I had talked about how to deal with stress in patient in during time of this COVID-19 epidemic. Now I'm here to answer a question which a lot of people are asking me, and the question is, should we be wearing masks when we go out during this epidemic? Well, this is a very valid question because the guidelines have been changing in last few weeks and people are very confused. Before I answer this question, let me give you some facts which will help us to decide whether we need to wear a mask when we go out or not. About 4 months back, when this epidemic started, WHO and most health authorities felt that the mode of transmission of this virus was through respiratory droplets, and second mode was contact transmission. Well, sounds confusing, but it's not. Let me try to explain in very simple language what these terms mean. See, whenever a person with the COVID-19 infection coughs or sneezes, he brings out the virus in form of respiratory droplets. Now, these droplets are of size of 5 micrometers to 10 micrometers. Since they are heavy and because of Earth's gravity, they don't stay in air for very long time and they fall down to the ground or to surfaces like tables, glasses, doorknobs, door handles, and they don't go very far either. They don't go beyond 1 meter. But supposing someone unfortunately comes within this 1 meter and is exposed to this respiratory droplets, he might get infected with COVID-19 infection. And if he does so, this is transmission by respiratory droplets. Now, the second mode of transmission which WHO felt was contact transmission. Now, this means supposing I just talked that these respiratory droplets fall down and they are layered on the adjoining surfaces which mentioned before. So someone comes in contact with these infected surfaces, there are chances if he touches that infected surface and puts his infected hands to his mouth or nose, he might infect himself. So this transmission is called transmission by contact transmission. Now, in view of this, WHO and most authorities felt the basic way to prevent this infection was by social distancing, which I'm sure all of us are following, and second was by proper hand washing, and third was to unnecessarily not touch our face, especially mouth and nose. So this was the basic, they felt how we can prevent this infection. But they also suggested that masks should be worn by general public only in two conditions. That was if they were themselves infected with COVID-19 infection or COVID-19 symptoms like cough and cold, or they were taking care of patients with COVID-19 infection or patients who had symptoms of cough and cold. So these were the two basic indications of wearing a mask till few weeks back. But over last 2-3 weeks, it has been seen there's been a marked increase in rise of COVID-19 infections. So people started scratching their head and they started thinking, could there be another method? See, there's a virus called measles virus, which I'm sure all of you must have heard. It spreads by airborne transmission or aerosol transmission. Now, what is this? This is not again confusing. It just means whenever a infected person coughs out, he brings out viruses in droplets which are smaller than the droplets I mentioned before. And since these droplets are smaller and they're lighter, they tend to float around in the air and they can be carried by air currents to areas more than 1 meter. So, and supposing someone unfortunately walks in this infected air, he may or may not get infected. Now, this is not an accepted mode of transmission, but there is a possibility of this transmission by in coronavirus also. So rather than take a chance, many countries, including India, have decided it is better to wear a mask when they go out in public. So I fully agree with this, and I feel it is a very simple and an inexpensive way of not getting infected. So I would suggest all of you should wear a mask when you go out in public. Now, should I wear a mask in the house? That's the next question. Well, if your family members are not affected or they don't have symptoms and cough and cold, there is perhaps not any reason for you to wear a mask in the house. But before this, I would like to emphasize it is very important social distancing, then hand washing, and not touching your face unnecessary for the reasons which I have tried to explain in my previous part of lecture. And another thing which I would like to emphasize now is whenever you wear a mask, please wear it properly. I've seen people wearing the mask just below the nose, or the lower ends of the mask are not put properly behind the ears, and as a result, the mask just hangs down or is partly covering the chin. This is not going to help you at all. You're just making a fool of yourself if you do such a thing. So please wear the mask. Maybe I will have another lecture on to tell you how to wear the mask. So I hope you found this lecture interesting and informative. And in next few lectures, I'll try to cover more topics, like another important point is how to wear the mask, and which type of mask you should be wearing. But I'll try to cover that in the next lecture. If you have any queries, you can write to me on my Facebook page, Wellness with Dr. Tarun Satija, and I'll definitely try to answer them. Meanwhile, stay at home, be safe, and take care. God bless. Thank you.